And I'm glad to tell you that we have Christa Hyson from the Health Collaborative back up with us via Skype. Christa, good morning. Thanks again so much for joining us. Let's get right to it.
Good morning.
Good morning again. We were talking a little bit, we had asked you before about whether or not we're prepared for a hospital surge. We know the National Guard was over at the Duke Energy Center evaluating it for a build out. Are we ready?
Yes, so we do have quite an advantage right now just because we are learning from other parts of the world, other states, and we're very fortunate to have a little bit more time on our side in order to best prepare. So yes, local leaders along with the National Guard on April 1st were at Duke Energy Center doing a site evaluation. So we kind of explore what those possible energy rates could be for a surge capacity. So we make sure that that type of site, and we're also looking at multiple venues to make sure that that is the best site possible.
Okay, great. And how are the healthcare workers holding up? I mean, just the anticipation of this has got to be stressful.
Absolutely. So, it's an absolutely stressful situation, but local hospitals have really made sure that they are doing whatever they can to create the safest way possible for people to come to work, whether that is through screening on site, limiting visitation, although frustrating, it is all for the betterment to protect our healthcare workforce.
Yeah, definitely. And we know that there are so many people who can have this and they're asymptomatic. They don't have any symptoms. They don't look sick. They don't sound sick. So the CDC is now saying people should be wearing those cloth masks, maybe to prevent the spread of the virus. What are you guys saying about that? Are you going along with that recommendation?
So I think there's a lot of confusion in the masking situation. So there's two types of main masks. So one is that surgical mask you'll see, and then one is the N95 respirator. So that one is going to be the best bet, but those are in need for our healthcare workforce. The homemade masks kind of have some variables with them. So things like thickness, lining, that can play into part of what filters in and out. However, those types of masks, because they don't have a respirator attached to them, they're more about keeping your own germs to yourself than protecting you about what comes in. And then it's also actually a nice reminder to not touch your face.
Yeah, definitely. Well, thank you so much, Christa, for joining us this morning. Is your kitty cat with you?
Yes, I do have somebody.
All right, really, really quick, just introduce us to Kitty Cat, because we don't have the animals here on Saturday mornings anymore.
This is Troy, and he's 17.
Oh, yikes. Okay, so he's an old boy. Well, he's very sweet. We love orange cats. Thank you so much again for joining us. Have a great morning.
Thank you.